For this week, we're gonna have some views of the femur, hip, and pelvic. We're gonna start with the femur. We're gonna have a cassette of 14 by 17 and SID of 40 inches. Before we left the room, we're gonna ask the patient, do not move and do not breathe on all the views. For femur AP, we're gonna do for distal femur. We're gonna ask the patient to place their bottom of the film 2 inches below the knee joint, and the patient needs to be upright. And in the leg, internally rotate 5 degrees. The center ray will be midpoint on the femur. For lateral femur, we're gonna have the patient rotate the patient toward the affected side, place the leg on the film receptor plane, adjust the film so that the lower border is 2 inches below the knee joint, and the center ray will be on the center of the film. For hip views, we're gonna use a 10 by 12 cassette and a SID of 40 inches. For anterior-posterior hip, we're gonna have the patient A to B position. We're gonna ask them to internally rotate 10 to 15 degrees the affected leg to open the femoral neck, and the central ray will be bisecting a line between the axis and the symphysis pubis, then centering to the point approximately 1.5 to 2 inches inferior and perpendicular to the bisected line to the center of the film shield approximately. For hip frog leg lateral, we're gonna have the patient standing A to P position. Patient bend the knee so that the foot is resting on the tip of the toe. Abduct the leg as far as possible. The center ray will be direct to the point found by bisecting a line between the axis and the pubis symphysis, then centering to a point approximately 1.5 to 2 inches inferior and perpendicular to the bisected line to the center of the film. For A to P pelvic, we're gonna have a 14 by 17 cassette and a SID of 40 inches. We're gonna ask the patient to stand upright in A to P position and with the feet 50 to 20 degrees internally rotate to see the femoral neck parallel with the film image receptor. We're gonna have a center ray that enter perpendicular midway between the axis and the pubis symphysis, and can check positioning by ensuring the image receptor 1 to 1.5 inches above the iliac crest. For pelvic outlet view and pelvic inlet view, we're gonna use a SID of 40 inches and a cassette of 14 by 17. Before we left the room, we wanna say to the patient, do not move and do not breathe. For pelvic outlet view, we're gonna have the patient to straight up, A to B position, and medially rotate the legs 15 to 20 degrees. We're gonna use a gonal shield, and the center ray for females are gonna be 30 to 45 degrees cephalic, enter at the pubic symphysis or greater trochanter, and for males are gonna be 20 to 30 degrees cephalic. For pelvic inlet, we're gonna have the patient straight up, A to B position, medially rotate the leg 15 to 20 degrees, internally rotate them, and the center ray will be angle 45 degree angle caudal entering at the level of the axis. For Juliet view, we're gonna have the patient rotate on the unaffected side. Affected side is elevated 45 degrees, and the center ray will be perpendicular, entering 2 inches inferior to the axis on the affected side.